This video we're going to discuss the nursing management of prematurity. Okay, now before you start looking at the nursing management, one of those things that you should know is that there are many physiological functions a preterm baby is unable to perform adequately due to immaturity. Therefore, neonatal care attempt to compensate for the deficiency until such a time when the infant is able to cope unaided. Now, before you start the management, the nursing management, you need to come up with the aims. So, one of the aims that we came up with is to initiate and maintain respiration. The reason we came up with this aim is because we've noticed that this baby has immature lungs, and therefore this baby is going to have problems when it comes to breathing. Then to prevent hypothermia, because we know that this baby has less subcutaneous, so there is less subcutaneous fats. Therefore, this baby, once exposed to coldness, they can end up with hypothermia. And then to prevent infections, obviously we know that the immune system is not fully developed and this baby can easily get sick. Then to prevent hypoglycemia, because we know that the liver is not yet fully developed to convert glucose to glycogen or to so now all these aims, they're giving us points to how to manage this baby. So now after the aims, one thing that you need to know is that prematurity is an emergence neonatal condition. It is an emergence neonatal condition. Therefore, we're going to divide our management into immediate care and subsequent care. So now we're going to start with immediate care. So when you write immediate care, your next heading should be resuscitation of the child or patient resuscitation. Now under patient resuscitation, you're going to discuss the ABC, which is the airway, the breathing, and the circulation. So now under airway, we're going to perform suctioning to remove secretions and of course to create a clear airway pattern. Then we are going to reposition the baby to promote free flow of secretions. Once you are done with that particular point, you move on to breathing. Under breathing, we are going to give 1 to 2 liters of oxygen per minute. This is to promote tissue perfusion and of course the delivery of oxygen to the body tissue. Now at this particular point, we are not going to talk about nursing a baby in a well ventilated environment, because we are going to expose the baby to coldness, which can lead to hypothermia. So under breathing, on this particular condition, we are not going to talk about exposing the baby to a well ventilated environment. Only giving oxygen is our aim at this particular point. Then after breathing, we're going to discuss or we're going to talk about circulation. Now under circulation, you give fluids to this baby, fluids like normal saline. So you're giving normal saline because it is a blood expander, and you're giving you can also give fluids like dextrose 5% because it's for energy. Okay, so now when you talk about those three, the ABC, when you've resuscitated the baby, it means you've talked about our first aim, which is to initiate and maintain respirations. So now we are going to move on to prevent hypothermia. Now when it comes to preventing hypothermia, you need to put the baby in an incubator. You need to put the baby in an incubator and check the temperature hourly until the baby is stable. Then in the absence of the incubator, you need to utilize the Kangaroo Method to nurse the baby. To those of you who don't know the kangaroo method, this is where you do skin to skin contact between the mother and the baby, so that the mother can keep the baby warm. And then you need to maintain the room temperature at 36.2 degrees Celsius to 36.7 degrees Celsius. Then one thing that you need to do as you're putting the baby, or you're nursing the baby in this incubator, you should not be opening the incubator unnecessarily, because you can expose the baby to coldness, which can lead to hypothermia. And then make sure that you wash your hands before touching the baby that is under hypothermia. So we are trying to prevent hypothermia. And of course, one of those things that we can talk about is to always wrap the baby in a blanket or something that can keep the baby warm. Okay, so that is under hypothermia. After hypothermia, we can talk about prevention of hypoglycemia. When you're talking about prevention of hypoglycemia, on this point we need to talk about early feeding, because it is very important to prevent hypothermia. And you need to do daily sugar test. The reason you're doing daily sugar test is to rule out hypoglycemia, and also if it is less than normal, then you should suspect hypoglycemia. So what is the normal? So we're talking about the normal, which is 2.5 millimoles per liter to 7.2 millimoles per liter. So if it is less than normal, of course it can lead to fits and mental retardation. Under the same hypoglycemia, we can talk about feeding the child through the NG tube, which is the nasogastric tube, or bicup if the baby has the swallowing defects. Now, if the baby is unable to feed through those two methods that I've mentioned, you can give 10% dextrose, which is given through IV, and then you give 60 ml per kg in the first 24 to 48 hours. Now, when you're feeding a baby through NG tube, always give expressed breast milk. So now, the way we give this express breast milk is that in the first 24 hours, we give 60 ml per kg body weight of that milk. Then on the second day, we give 90 ml per kg body weight. On the third day, we give 120 ml per kg body weight. On the fourth day, we give 150 ml per kg body weight. Now, all this, if you've noticed, we are adding 30 ml each day. So that's how we feed the baby through the NG tube. A premature baby, we feed them in that manner. Now, all these amounts should be given in divided doses. You shouldn't give the baby the whole 60 ml in the first 24 hours just at once. So it needs to be divided. For example, in 3 divided doses, where you're giving 20 ml, let's say 20 ml 8 hourly. Okay, so you can do things like that. And then you need to give these feeds in small frequent feeds and ensure that the baby is not overfed. Then record all the feeds on the feeds chart. At that particular point, it means we've discussed the prevention of hypothermia. Then we can look at the prevention of infections. When you're talking about the prevention of infections, on this one you need to keep the unit where the baby is being nursed, that is the incubator. It has to be kept clean by damp dusting, and then you need to wash your hands before and after handling the baby. Then you need to make sure that all the members of staff staff are free from infectious diseases, because you want to prevent cross infections to the baby. Also, you need to isolate babies who are infectious, or those babies who have infectious conditions, with the same reason to prevent cross infections. Then you need to minimize the number of visitors. Okay, so we've discussed all these 4 points on our nursing aims, which is to initiate and maintain respiration, where we talked about the ABC, to prevent hypothermia, to prevent infections, and to prevent hypoglycemia. So that is the immediate care. In our next video, we're going to be talking about the subsequent care that follows, the care that follows after you do the immediate care.